Autism spectrum disorder, also known as ASD, is a genetic mutation disorder that affects 1 out of 36 people in the United States, according to the UCLA Health. It is a developmental disability that affects the nervous system. It gives the person a hard time with social communication and interaction, as well as repetitive behaviors and interests. Autism is usually a genetic and inheritable disorder, but some research has shown that autism can be caused by environmental factors as well. According to Autism Speaks, it has been found that on average, 80% of people with ASD have had some ancestors with the same disorder, showing that this is a pattern of inheritance, while the other 20% of people got it from a genetic mutation. While everyone can be born with ASD, it is most common with people with older parents, siblings with ASD, complications at birth, and people with already present genetic conditions like Down syndrome. It has also been found that boys are 4 times more likely to be born with autism. According to the NYU Longhorn Health Statistics, it has been found that on average, 74% of people with autism graduate high school with a diploma, 90% graduate with a certificate, and 8% do not graduate at all.
Some symptoms of autism include lack of eye contact, lack of early verbal communication, lack of language skills, difficulty understanding people's emotions, hyperfixations, trouble communicating issues or feelings, and repeated motions. While these are the most common symptoms, some autistic people may have more or less due to being farther or lower on the autism spectrum. To determine whether someone has autism or not, specialists will use the Autism Diagnostics Observation Schedule. This is a standardized test of communications, social interactions, play, and restricted and repetitive behaviors. During this observation, a specialist interacts daily with the patient during all of the activities and communications that they will go through. They also look at the child's development rate as well as their behavioral patterns. While autism is non-curable, there are treatments available for those on the autism spectrum to make living a little bit more manageable. For example, there is behavior management therapy. This type of therapy reinforces positive behaviors and helps mitigate negative behaviors. There is also medications like risperidone or stimulants. These medications can decrease hyperactivity and decrease stereotypical behaviors that you see in autistic patients. Sorry, this wasn't our script, but I would just like to say to not ever treat somebody differently or wrongly based on having this disorder, because all of the stereotypes surrounding it are simply not true. When people call them dumb or slow or whatever, I think that it's total BS, because it's terrible to say that about somebody when it's really just not true. I've met so many autistic people who are so much kinder, so much smarter than normal neurotypical people. And you should never judge someone for a disease that they have, because that's not what they are. They're much more than that. They're normal human beings like everybody else. And I just wanted to say that because I've seen it happen too many times to people that I know who have it. And I think that it's really wrong and disgusting to see it happen in the real world. So just wanted to say that. Thanks. Bye.